Namaste and good afternoon. Welcome to the FB Live series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram. I hope you've all been well and safe. Many a time, it is the lack of knowledge about our body and health that lands us up into severe health complications and diseases. This is why we at Apollo Hospitals have been having several of these FB Live sessions to give you the best of authentic and factual information from our experts who are world renowned and top specialists in their respective fields. So, today we are discussing a very common condition, but also a condition which many of us are not aware of. And even if we are aware, we kind of ignore it in the humdrum of our daily existence. And that is the metabolic syndrome. So we're going to discuss why does metabolic syndrome matter. Metabolic syndrome, which is also known as syndrome X or dysmetabolic syndrome, is a cluster of metabolic conditions that can pose a risk to many health complications, including heart disease. The main features of the metabolic syndrome, though doctor will be explaining to us in detail, would include insulin resistance, hypertension, abnormal cholesterol, increased risk for clotting, and usually such people are also overweight and obese. Metabolic syndrome is a condition that can lead to both diabetes and heart disease, which are two of the most common chronic non-communicable diseases today. But the good news is that though this syndrome is common, it can be managed, it can be reduced, it can also be reversed. And doctor will tell us how. So I am delighted and honored to welcome Dr. Girish Navasundi, Senior Consultant and Interventional Cardiologist from Apollo Hospitals, Bangalore. Dr. Navasundi completed his MBBS from the JSS Medical College, Mysore, and his MD in General Medicine from the Jawaharlal Nehru Medical College of Belgaum in Karnataka, and then he went on to do his DNB in cardiology. He has performed over 4,000 angiograms, about 1,600 angioplasties, and many procedures like PDA closures, ASD device closures, IVC filter deployment, permanent pacemaker implantation, and implantation of devices for heart failure, AICD, etc., and also TAVR and stent grafts for aortic aneurysm and dissections. He has extensive experience in the usage of rotablation, IVUS, FFR, distal protection devices, covered stents, IVC filters, thrombectomy, and many more. He is the first cardiologist to implant the adsorbed stent in private healthcare sector in the state of Karnataka. He has other firsts, first cardiologist to implant the MRI compatible AICD system in Karnataka, and also the first to implant the tapering coronary stent in the state of Karnataka, and has also got many numerous publications and papers to his credit. Welcome, Dr. Navasundi. Thank you so much for joining this FB Live, and we look forward to hearing from you why metabolic syndrome matters.
Thank you, Dr. Srinidhi. It's a wonderful topic that has been selected for discussion, and it should be close to many hearts for preventing diseases. Uh, as you rightly said, in the humdrum of the daily living, we forget to understand the early signs of risk factors for major diseases such as heart failure, stroke, kidney failure, or cancers. The focus on early identification of risk factors which eventually lead to major diseases has not been really discussed or debated or understood for a long time. And this has been a good opportunity. And to speak about metabolic syndrome, as yourself has very well explained, it's a cluster of risk factors which eventually makes one vulnerable for developing heart disease, stroke, and diabetes. The clusters of risk factors include what we call abdominal obesity, means increase in the circumference of the waist, more than 40 inches for men and more than 35 for women. Increase in the blood pressure, more than 130 systolic and more than 85 diastolic. Slight increase in the fasting blood sugar, that's more than 100 milligrams per deciliter, and increase in triglycerides, more than 150 milligrams, and reduction in HDL, less than 50 for women and less than 40 for men. These cholesterol, HDL is a good cholesterol. Lower the good cholesterol, higher the possibility of future events. And then comes the lastly the fundamental abnormality, that is insulin resistance. If one has three or more among these five components, that is increased obesity, what we call abdominal obesity, increased triglycerides, decreased HDL, higher blood pressure, and higher blood sugars. Three or more of this constitute metabolic syndrome. Why is it important to know about metabolic syndrome? This is one cluster which is not considered as a disease, but it's a cluster of minor abnormal findings which do not have typical symptoms to start correcting, but if one waits long enough, leads to subclinical disease. That means disease is progressing before one is diagnosed with a catastrophic event, either as a stroke or a heart attack or a heart failure. So between 20 to 40% of the adults could be having the metabolic syndrome. All of them need not be really obese apparently when you look at them, but once a physician evaluates them, in detail in terms of their body mass index, weight, circumference, looks at their blood pressure, blood sugar, cholesterol, many of these people can be detected very early and motivated to live a better quality of life, which can reverse these risk factors and prevent them from having major cardiovascular events in the future. And there's been a lot of research that is going on to understand the effect of multiple but small abnormalities, which can lead to a large amount of disease burden in the community. So I think to that perspective, this is a very important topic that has to be understood by large population, because it is quite cheaper to prevent disease than treat many of the disease.
So, what are the causes of metabolic syndrome?
Right. I think genetics and lifestyle both have roles in the origin of metabolic syndrome. Looking at the most important component is overweight. So that genetics we cannot change. What we can change is our lifestyle. So in terms of how we eat, how much activity do we have, and how good we sleep. I think these are the three main components of the risk modification that we can do in terms of lifestyle. Eating is very, very important. I think you need to restrict your carbohydrate component in the diet to less than 50% and try to have whole grain as the main source of carbohydrate, and then also have legumin. And when you look at the poultry, have the lean meat, and then when you look at the dairy, try to avoid whole milk and have probably toned milk. These are the ways to prevent the onset of the metabolic syndrome.
Is there a gender variation as far as metabolic syndrome goes? Because one also finds the women disadvantaged as they cross the menopausal age, where there is also a tendency to develop a bit of fatigue and their stamina, exercise capacity, or there are also factors which make them add weight. So, what would you recommend for women, particularly, to be aware regarding metabolic syndrome, or is it even common in them?
I think it is more relevant for women, especially in our societies. Women health is one of the most neglected aspect of medical care in our society. And also, women tend to be the caregivers, and they less often focus on their own health. Not only they themselves, even the families do not seem to pay enough adequate attention. As you appropriately said, postmenopausal, the onset of the diseases seems to be much more faster in women than men of the same age. Once the protective effect of estrogen, which is naturally originating from the ovaries, dies down, uh, their chance of getting heart attack, stroke, renal failure accelerates much faster than men of the same age. Secondly, these women in this age group tend to be much more sedentary. They tend to have the food, which is more convenient rather than what is healthy, or what is they probably choose their choice as the last. The rest of the family gets to choose what they would like to eat. And thirdly, the exercise, they do not seem to value it because they believe they're adequately working within the confines of the homes or the kitchens. So this leads to inadequate amount of exercise, spending of the calories, adequate amount of sleep, and then definitely the food is not the most ideal. And eventually they develop, most women develop abdominal obesity. They do less than optimal exercise, and the worst part, they are the least examined by the physicians to know their risks, to motivate them enough to reverse the metabolic syndrome. So they are more vulnerable than men beyond menopausal age.
So, could we now talk a little bit about how metabolic syndrome affects? I mean, how does it progress, or how does it cause heart disease? And at what stages can it be actually reversed? And can the heart, once the heart disease comes, or there is already manifestation of diabetes, or there is dyslipidemia, how much of it can actually be reversed, and how?
I think the most beautiful aspect of metabolic syndrome is, to a large extent, it is reversible. It just requires a strong motivation. So, coming to how does it affect the cardiovascular system or any other organ? The fundamental abnormality in metabolic syndrome is that because of all these cluster of risk factors, there is increased insulin resistance. That means the amount of insulin that is produced by the pancreas is not optimally utilized, or the effect of this insulin on the organ is reduced or numbed by increased resistance to the effect of the insulin. So there is reduced utilization of the metabolic components, such as the sugar is not handled well, the triglycerides are not handled well. That leads to eventually what we call endothelial dysfunction. That means the innermost layer of the blood vessel seem to become dysfunctional or malfunctioning, which leads to deposition of these cholesterols within the blood pipe. It leads to decreased motility of the blood pipe. That means the blood pipe does not expand adequately to allow the blood flow. Thirdly, it becomes more clottable. So there could be sudden clotting, which may lead to heart attack or paralytic strokes. That is how the major cause is the dysfunction of the inner layer of the blood pipe, which leads to either heart attack, paralytic strokes, kidney failure, or loss of limb. Secondly, this insulin resistance also clusters to affect the functioning of the heart due to abnormal hormonal and neurological stimulation. There is increased stress hormones, which are counter to insulin, and there is increased levels of the heart rate, blood pressure, which eventually causes heart muscle to become thicker and stiffer, and makes it to work harder than usual to supply that extra mass, which makes it eventually vulnerable.
How does it affect the other organs? Does it affect only the heart, or does it also have an effect on other vital organs in our body, doctor?
Fantastic question. It does not restrict its affliction only to heart. It also affects pancreas, leading to significant early onset or worsening of diabetes. It affects the liver, leading to excessive fat deposition called NASH. Eventually, it can even lead to liver failure called cirrhosis. It affects, people with metabolic syndrome are at more than 50% risk of developing kidney failure too.
Okay.
And it affects the joints. It affects multiple organs due to the same fundamental cluster of risk factors.
And is there a particular, though we did talk about how it can be reversed due to lifestyle changes and a motivation on the part of the individual to reverse these readings? Are there also medications for the different aspects, like, for example, to improve insulin sensitivity or to reduce the cholesterol? At what stage should people take these medicines?
There are medicines, but I think in the situation of a medical metabolic syndrome, the primary focus still is on the lifestyle. Medicines do have a role, but that's the last that a doctor would be using to reverse it. It is a simple problem, which is primarily brought upon by lifestyle over a genetic predisposition. Since we can't do much about the genetics, keeping that apart, one must really focus on their diet, exercise, and sleep. Although there are medicines, I think they have to be very appropriately selected, because all the five components may not be elevated to the same extent, be it blood sugar, be it triglycerides, or the HDL, or the obesity component. I think each individual would have a varying degree of abnormality in them. So we would be looking at particular abnormality and direct a drug only towards that, not all of them put together. But those who are really morbidly obese, I think we would use anti-obesity medicines as well when it is appropriate. But most focus goes on
Um,
building a relation and working together to reverse in terms of lifestyle and eating.
So this is one condition where I think the patient himself is the primary person who actually treats his own disease.
Absolutely, he's his own doctor. We are just the motivators and fact check guys.
We'll now look at some questions that are coming in from our viewers. So one is it, you were talking about hereditary. So is it, what kind of heredity does metabolic syndrome have?
You may have seen that people who are born into families which are overweight tend to be overweight. The families who have had diabetes at a younger age tend to have their progeny, their children or siblings, to become diabetic slightly at an early age. This means, you just look at your own family tree and know your probable risk for future development of this disease. At this point, one may be feeling perfect about themselves, are very fit, doing marathon run or playing great games, but the family history would tell us that I may not be able to indulge like someone else. I may have to be much more cautious than someone else of my own age, just because I do not have the great genes that others may have it. So my own family history would tell me that I may still need to be more cautious than others.
How can we prevent metabolic syndrome in kids?
Fabulous question. I think everything should start at home, in school, not on every page on a for the adults. The If you really look at olden days, if you all go back to be children, I'm sure most of us will not have diseases. It's just that growing up makes us at unease, or what you call dis-ease. This all requires is stay very happy, stay very active, eat what you like, but spend a lot more than what you eat. And third, I think at home it's very important for parents, especially the mothers, to display the most wonderful fruits, vegetables on tables than just some toffees or sweets or fried things. how we cultivate a culture of eating and playfulness, which is physical, and a very good sleeping habit, what eventually makes the community healthy. I think teaching in the schools, the more the physical part into it and less of stress, the two ways to go about it. And every school must have an incentive for healthy kids to influence others. I mean, that's how I would look at it.
That's a wonderful suggestion, doctor, because I think you were talking about our childhoods where we did not have so much stress and we laughed and we played. But I think today children are the most stressed out groups because as they grow, there is so much of pressure on them. And then now they're not even able to go to school. And it is, I think sometimes I'm happy that we have completed our childhoods because it's so much worse for them and they're quite sedentary because they're always studying and all going for classes and things like that. But I do hope that, I think this is such a wonderful suggestion that schools actually take this up as some kind of a role modeling for other kids and talk about it a lot in parents meetings and things like that. And then I really think that's the way forward. The next question is, what kind of diet is to be followed in metabolic syndrome?
I think what is right for you and me is right for metabolic syndrome. As I started off, try to eat as much as we just need rather than hoping that I'm enjoying it just because I can afford. I should not indulge. Uh, I must really value because we all have only one body to live in. So we should really nurture it and manage it well. So when you eat, I think eat very appropriately in terms of have 3 meals a day. Before every meal, try to have a lot of fruits and vegetables because they really nourish and give you a lot of vitamins, minerals, and fibers, along with a lot of water. And thirdly, try to restrict your carbohydrate component to less than 50%, and maybe proteins about 30%, and fats to less than 20%. And if you're using fats, try and use vegetable based fats than animal based fats. When you consume meat, I think lean meat is far better than red meat. If we have to indulge, we know it's like sinning, it better be worth it. Otherwise, don't do it. And have those days when you will really work out and spend that extra what we have consumed on the weeks. And lastly, make a schedule for the week what you would like to eat. Very colorful, very fresh. Try and avoid the boxed food or what we call are the ready-made foods that we can order. Try to keep it to the minimum possible.
The next thing is about how can we handle what is the role of stress in metabolic syndrome? Uh, so this is one component which is now playing a major role in many diseases. But this is the one thing which is, I think, the most difficult to resolve too. So, what is your? This is something which I also would like to know. What would be your recommendations for
Yeah,
stress management and sleep management, both
absolutely.
of which we know play a role in metabolic syndrome?
Many more diseases too. I, to me, to keep the stress in a very simple manner, simple understanding, stress is the gap between the promise that we make and what we can deliver. As long as our expectations are realistic about what I can deliver, and that is all I would promise, there is no stress. Second, we need to go back and be children. Don't, ambitious is good, but ambition should not be more valuable than happiness and peace. But that's how I look at it because I see many of young guys these days. They come to me at a very young age with hypertension, heart disease, very poor heart function, very poor quality of sleep. They seem to confuse ambition with prosperity. Prosperous person is one who has adequate time to do what he wants in his life, not just adequate resources. So that requires efficiency. So if you really ask me how to be, as you said, stress less. It's very difficult because once you're born into an animal kingdom, whether humans or animals, there's always small amount of insecurity or threat. That's why the stress hormones exist. Being humans, we are capable of, having a additional forebrain, which helps us to analyze and get over the emotions which make somebody very uncomfortable. How to have least stress? I have devised a manner where I try to stay in the moment. I do not think about the previous moment because that makes you worried. Depressed. If I think about tomorrow, I get worried about it. So stay in the moment every day that you work, and make a promise that I can keep every day. And thirdly, try and choose the company that gives joy, then that gives you a certain sense of companionship. And fourthly, fiercely guard your sleep. Do not barter it for any progress or prosperity, because that is the time when your body just lies down, paralyzes itself, and all that stress hormones and stress stimuli from the nervous system are shut down so the body can rejuvenate. So try to switch off all bright things beyond 9:30 or 10 p.m. Avoid taking calls, however urgent. Try and share between people. Work in groups. Don't try to be a lone fighter, so that community gets what it deserves, but you get adequate sleep.
Absolutely. I think this has been a very useful discussion, Doctor, because we have discussed all aspects of not only metabolic syndrome, but what people must do to have a good lifestyle and avoid a variety of diseases. Thank you so much. Dear viewers, I hope that you have understood about metabolic syndrome and you will make all efforts to look at the alarm signs, alarm signals, and reduce your risks as much as possible by maintaining a healthy lifestyle through, as doctor said, through diet, through exercise, through stress management, and proper sleep hygiene. You can also subscribe to our YouTube channel, and you can continue to look at our Facebook page. Put your comments in there because we have many more exciting topics coming up as well. And you can see all our past sessions as well on very important and useful health topics that you must all be aware of. Till we meet again, thank you and stay safe and stay healthy. Be well. Namaste.